over some of the blood vessels that are found here on our torso model. Okay, and I think a good place to start is the heart, because a lot of different blood vessels are going to branch from there, and right, we need to pump the oxygenated blood to the body, right, and then we need to drain the deoxygenated blood back into the heart so it can go to the lungs and get reoxygenated. Okay, so let's more or less start off with the heart and follow some of the structures. Okay, so coming off here, we have the ascending aorta, and then it then turns into the aortic arch, right? And so there are three main blood vessels that come off the aortic arch. Just remember B, C, S. Okay? So you have the brachiocephalic trunk, and then next to it is the left common carotid, and then you also have this one, which is the left subclavian. So the left subclavian comes here, and then it's found right there. Okay, so the left common carotid goes all the way up. It comes up here, and then after the brachiocephalic, so I'll say about right here, it then turns into the right common carotid. Okay, so we've talked about all of that, and how does this branch? Right, so the rule of thumb here is that it's before it branches, they call it common. Right, so we talked about the common carotid, and it's going to branch into the internal carotid and then the external carotid. Okay, well, the first one, the external carotid, has a variety of structures that it's going to give blood to. Okay, so coming up here, this is the thyroid. So this is the thyroid, superior thyroid artery. Okay. And then coming off, branching this way, this is where the tongue is, so this is the lingual artery. And then coming up here, this is the maxillary artery. Okay. So all of those, the ones that I just mentioned, 1, 2, 3, all of those are coming from the external. Okay. But if you follow the internal carotid, it goes in here, and then we follow it in here. You can see it on the torso model from this position. Right, it's going up into the brain, because the brain needs its blood supply. Right? And what it has to, what the internal carotid artery travels through, is in the skull, the carotid canal. It's like down right there. So the internal carotid goes in, and then put this guy down. You see the internal carotid artery right here. And the internal carotid artery it branches and it helps to form what's known as the circle of Willis. Okay? So if I'm looking at the brain from an inferior view, right, I'll see that this internal carotid artery is coming in, and then it's going to branch into the middle cerebral artery, and then it also forms the anterior cerebral artery. Okay, because you have to supply blood to all the different regions of the brain. Okay, so that's for the internal carotid. So, for instance, this brain model, right, it sits in there like this. Okay, and so if we look at it from this point of view, so this is anterior, so that's the anterior cerebral artery, and then this one here in the back, that's the posterior cerebral artery. Okay, well, where does the posterior cerebral artery come from? That's why I have my spine model here. So if you look at it here, we see that this is the vertebral artery coming all the way up, right, through the vertebrae, and then they're going to merge together and form the basilar artery, which is this guy right here. So this is the basilar artery. And then the basilar artery comes up, and that's what then branches into the posterior cerebral artery. So now we have our full circle of Willis, so blood supply can go to the brain. Okay, so so that's here. A little bit about the venous, the drainage. So we talked about giving or transporting oxygenated blood all the way to the brain, right? Well, we also have to drain the fluid that's in the brain, like the blood, the cerebrospinal fluid and everything. And so cerebrospinal fluid circulates through here. And so this is the superior sagittal sinus. This one is the inferior sagittal sinus. And then this is the straight sinus. So all of this, it's venous because it's going back to the heart, right? So now I put my heart or torso model back up here. Then I see, right, it's draining here into the internal jugular vein. Like just like we learned about lymphatic system, everything is coming here, it's getting drained into this region, right? The internal jugular vein, the subclavian vein, and then both of these, so the brachiocephalic vein, right? Because there's two of them. And then they all merge here at the superior vena cava, right, which gets dumped into the right atrium. Okay, so then how do we oxygenate the blood? Well, it has to go through the lungs. And what does it travel through? So first, it travels through the pulmonary arteries. Remember that arteries go away from the heart. So you have a pulmonary artery going here, blood goes into the lungs, gets oxygenated, and then the oxygenated blood comes back through the pulmonary veins, because veins go to the heart. So this oxygenated blood coming off for the pulmonary veins gets dumped into where? Well, the oxygenated blood, it gets dumped into here, into the left atrium, right? So we have my pulmonary veins here, they're also on this side, and you can also see here on the inside the pulmonary veins getting dumped into this atrium. Okay. So we've gone through that, and now let's put our heart back on here so we can continue. We've looked at the head and the neck going up, and then some of the blood coming down, but let's go back to the arterial system. So as it goes out, you have the ascending aorta, and then it's the aortic arch, and then from here, because this is ascending, this part is the descending aorta. So the descending aorta, this is the thorax. So you have the thoracic artery, right? It comes down here, goes through, travels all the way down. Because this is the abdomen, this is known as the abdominal aorta. The abdominal aorta, it then branches into these two different arteries. Okay, so the first one, so this is on the right side. So you have the common iliac, which then branches into the external iliac, and then the internal iliac goes this way. Okay, so remember once again the rule that I said earlier, it's common before it branches. So common, external, internal iliac. Okay. So then this one that's here, like right down the middle, that's known as the median sacral. Okay. And then once we pass through this region right here, this is known as so this is where the inguinal ligament is, and this is the femoral, it's now the femoral artery. So femoral artery. And then back up here, these are where the ribs are, and so in between you have the posterior intercostal arteries and veins that are in here. And then we also have these structures that are here in the back. Okay. So this one that's coming up, that's the azygous vein. Now remember we identified the azygous vein on the heart last week. It's coming in through here, right? This is where it is, the azygous vein, right? Because it's getting dumped into the superior vena cava. So then this one that's lateral to it, this is the hemizygous vein. So this guy right here goes here and then there. Alright, so hemizygous. Just leave that there. Alright, so now that we've done some of that, also some of the venous structures. So the inferior vena cava is this whole thing right here. So you have the inferior vena cava. These are so this is the kidney, right? So it needs blood and it needs to drain blood. So these are the renal veins. And then as you come down, so both of here, so 1 and 2, those are the iliac veins. Okay. So back to this point right here. You see these arteries and veins coming off right here? Those are the lumbar. So lumbar arteries and veins. And then what's coming off of here, these are the gonadal arteries and veins, right? So for females, it's ovaries. For male, it's testes. Okay. So then now let's look at 1, 2, and 3. What are these 3 main structures? So this one and this one. So these 2. So this is the superior mesenteric, and then this one on the bottom, that's the inferior mesenteric. Okay, so let's put that into context. All right. This is what I'm looking for. Okay. So, like I was saying, this one that's coming down, that's known as the superior mesenteric, right? That's what comes off of it's there, and then you can also see it right there. So superior mesenteric, and then once again, that's the inferior mesenteric. So now let's look at the intestines. So the intestines, it sits like this, and then let's see some of the structures for the intestine. So this one is the superior mesenteric, and then this is the inferior mesenteric. Okay, and we can start here. So from the inferior mesenteric, this part is the rectum. So this is the superior rectal artery, and then the part when it branches this way, this is known as the sigmoidal colon. Okay, so this is the sigmoidal artery. And then coming this way, because this is on the left side, this is the left colic artery. So the left colic artery is here, and it's coming from the middle colic artery, which branches from the superior mesenteric artery. So it goes here, middle colic, and then we have the right colic, and then this part over here. So the intestine has 3 regions. You have the duodenum, the jejunum, and the ileum. So the ileum is the last portion of the small intestine, right? That's what it then goes into the colon or the large intestine. Okay, it goes from there. So this part, this blood supply is known as the ileocecal artery, because it's for the ileum and also the cecum. Right? Which the cecum is just the colon itself. So ileocecal artery. Okay, so that's it for this guy. So let's go back to this. So we did superior and inferior mesenteric, and now let's look at, so this part is known as the celiac trunk. Various structures come off the celiac trunk. So this one going to this side, this is known as because this is the spleen, this is the splenic artery. And then coming off of here, this is known as the common hepatic artery. Right, so it's the common hepatic because when I put the liver back on, right, the liver sits like that, I put the liver back on, and then I take it off, I look at the structures that are here on the inside. So this is known as the proper hepatic. So remember, common is before proper. So this is the common hepatic artery. So then now we look at what this purple structure is. This is known as the hepatic portal vein, right? Because all the nutrients that are within the intestine, they have to get to the liver to be processed, and they do that by traveling through this, the hepatic portal vein. So that's what this guy is here, right? And then that's what's here in the liver, the hepatic portal vein. And then this other structure that's down here and then up here, right? Because the liver sits like this. That's the inferior vena cava. Because if I put the heart back on, right, that's where the inferior vena cava is. So the inferior vena cava, the liver, and then branching off of. So remember I said it was common, and then it turns into proper. Well, what comes off of here? This is the gastroduodenal artery, because this is the duodenum, which is the first part of the small intestine. And it's going to branch to give blood to the stomach, because the stomach sits like that to give it its blood supply.